Nistha, thank you for spending time with us this morning and talking about your research. If you would please describe your research topic under the POPPOV initiative and some of your key findings.
Sure. A well-known population fact about India, a dismal fact, is that there are far fewer women than men in the population. And this is a particular problem among the ages of 0 to 6. And what we study is an effort that the Indian government has made starting the 1990s to offer financial incentives to parents to discourage son preference and to encourage them to invest in their daughters' education and health. We study one state in North India called Haryana, and we picked this state for many reasons. One of them is the fact that Haryana, in fact, has among the worst sex ratios, the lowest number of females per males in the country. In 2001, the census assessed that there were only 820 women per 1,000 men in the state. And then earlier studies, right around the time the program was started, found that girls were more likely to die than boys before the age of 4. So clearly this is a state that faced problems, recognized that sex ratios, this adverse sex ratio, pose problems, both economic and social, and tried to do something about it. In 1994, they started a financial incentive program, and this financial incentive consisted of giving parents a cash transfer, an immediate cash transfer of about $11 if they gave birth to a daughter. And then they also received a long-term savings bond in the name of their daughter, which could be redeemed when she turned 18. But she had to meet certain conditions. She had to be unmarried at that time. And if she attended school up to certain grade levels, then she would get additional bonuses. And of course, the program changed in characteristics over time. So this was a program that began in 1994, and then the amount of the cash transfer provided increased over time, and then certain conditions were changed and added. But what we were able to investigate was how this program primarily meant to address adverse sex ratio in the state, affected or benefited women who were eligible and girls who were eligible to receive the program.
Did you have any surprising findings out of your research? Anything you found that you didn't expect to find?
Well, given that the first set of beneficiaries haven't turned 18 yet, they will turn 18 in 2012, which is next year. We would have liked to really look at how the girls responded to this program, which we were not able to do. So what we did find, however, was that mothers responded to the program. So we found that eligible women were reporting, after the program was introduced, were reporting more daughters per number of sons, even after 4 years after the program was introduced, which we find to be very interesting, that the incentive seemed to be working. We recognize that we have several limitations with the type of data we had. We used the National Family Health Survey, which is equivalent of the DHS, which has been widely used across in other countries. But we were able to detect these effects, which we think are very promising.
Future plans for continuing this research or perhaps replicating it elsewhere?
Definitely, because we want to extend and replicate. Several Indian states have actually introduced this program and different versions of it. And secondly, as I mentioned before, these girls are going to start becoming eligible to redeem these savings bonds starting next year. And what we plan to do is go back next year, hopefully given available funding, to look at these girls themselves and to see what the impact has been on, first of all, on marriage delay, which is a very innovative feature of the program, but also look at how have they invested in themselves so that they make any transitions into the labor market. And so look at a whole host of gender issues, but also transitions into the labor market. That would be very, very interesting given the context of Haryana.
Thank you. And given that the Population and Poverty Research Initiative is very committed to closing the gap between research and policy, Can you share with our web listeners some of what you feel are the policy implications of your research?
The financial incentives have been tried in various settings, in sort of very development questions have been addressed, or policymakers have tried to use financial incentives to address various development problems. Our research suggests that financial incentives are a potentially or promising approach to addressing this problem, which has been tried in other settings. So several countries that have low fertility have tried to use financial incentives to stimulate or to encourage births among mothers with inconclusive results. What we are finding here is that in a particular context of India, and this is a very specific problem, and it is a mix of gender issues combined with population demographic issues, this seems to work. Now, of course, the Indian policymakers seem to have recognized the effectiveness of this policy, and several states have already adopted it. But I think the implication for population policy is definitely that financial incentives should be among the menu of options that are considered by policymakers. And of course, the design would have to be fine-tuned. But also, I would like to add that there is a paucity of impact evaluations, of serious analyses of these kinds of programs. And again, thinking of India and similar countries which have similar problems, I would definitely like to see more researchers, in fact, trying to answer the question of whether these kind of policies work, even though the data might be less than perfect than what we would like to have to be able to do an impact evaluation, and that there are methodologies available to try to measure the impact and therefore narrow the gap between research and policy.
Nistha, thank you very much for sharing your research findings with us.